Primary care is the part of the NHS that most people encounter every day. So that's the kind of service that's delivered through our GPs, through our pharmacies, also through our optometrists and opticians, and also through dentists. That's the key element of primary care for us. But it includes our extended teams. So it will also include the staff that work with us in our premises, whether that's a pharmacy on the high street or your local GPs. So you'll be familiar with the nurses and the receptionists who work with us.
Primary care strategy underpins the Better Together program. It's based on several principles. It's based on the fact that we need to have care closer to home, that we need to have continuity of care, we need to encourage self-care, we need to have care which is quality driven, we need to have care which is more cost effective, and those few points which I mentioned need to work together to deliver a good Better Together program.
Developments for the future, I think, are the most exciting part of our strategy for primary care. We stand on the threshold of being able to do something much more imaginative with general practice, with pharmacies, with our dentists and with our optometrists going forward in the future. This is a time when we can really build on the very firm foundation of our excellent UK general practice and primary care services. It's an opportunity for us to look at the ways in which we deliver services, making sure that we've got the right staff delivering the right things in the right way. How can we make sure that out of hours services have access to the right kinds of information? Can we share our information about patient records more sensibly? Can we make sure that people have fewer visits to the hospital, to the general practice, to the dentist than are currently the case? Can we make sure that people can go to pharmacies for advice much more easily? Pharmacies are open a lot more often than general practices are, and being able to get advice 24 hours a day is starting to become something that people will expect from the future. But that doesn't mean that we've got enough staff to be able to open our practices for that length of time. So we'll be working with practices to say, how can we do this better? Can we extend the hours that we work? And many of our practices already do. We would hope that patients will be able to come to their practice to be seen in a more timely manner by a group of people who will be able to put packages of care together around them. This means that they would do a one-stop shop to the local practice, for example, to maybe have their blood tests done before surgery, to maybe have some advice about doing things like losing weight, stopping smoking and being able to be fitter and healthier before they have their surgery, which means that when they go into hospital they can stay for less time, so that when patients are discharged they're likely to be able to recover much more quickly, supported by therapy services that are delivered from the local practice.